So thanks to both of you very much for wonderful presentations. We have just a short time for discussion, and I think given our time limitation, we'll probably keep it here, and would encourage those in the audience to grab any of us during the breaks if you have specific questions for us. So in the effort of drawing together the two presentations, Jim, I'm attracted to your reference to Sean Maillet's sort of analysis of risk of excessive weight gain, and you pointed to the unregulated zone, which would correspond to the low end of the activity continuum. So presumably, if you're attracted to that model, there's some cut point for physical activity. Given what Aviva pointed out, do you think it's possible or likely that that cut point's not the same for different demographic subgroups?
I'd be surprised if it's actually the same, and I think that's where the work comes together. We need to look at those groups and then maybe even subgroups of those groups for where we're going to need them to be to get into that regulated zone. So it's a theoretical threshold, and I do think it's not the same for everybody. It's where genetics may come into play. If you're genetically fortunate, you get into there at a real low level of physical activity. It may take you a high level of physical activity, but the more we understand about the subgroups, the more likely we are to get there. We've got to quit debating on whether physical activity is important and figure out how to promote it, and part of that is, when are we done? At what level is it enough physical activity? So those are the questions I think we should be talking about, not if physical activity is important.
And Aviva, you showed statistics for the prevalence of overweight and obesity across demographic groups, and you did the same thing for physical activity. Has anyone put the two together? Really looked at the interaction between the two in these large data sets that we have available?
Well, there have been some attempts. You can hear me? Yes? There have been some attempts to look at the extent to which changes in physical activity patterns can predict the changes at the population level that we've been seeing in prevalence of obesity, and those actually have not shown a close association, which I'm not really sure should be surprising because there are a lot of other forces at play. The last slide that I showed of Penny Gordon-Larson's study was an attempt that showed that both having the environment that promotes physical activity and getting, I think it was the 5 bouts per week of physical activity, was actually associated at the individual level in lower risk of obesity. So I think what's challenging is drawing from null studies that there's no association. I mean, based on the physiology, there has to be an association, whether we can demonstrate it using our crude measures and study designs or not. That's not an anti-science statement, certainly, but I think that it's always dangerous to draw conclusions from null studies.
But I think that's an important point. That's why I go back to the physiology. Does it make sense there? If it doesn't, we need to learn something from it. If it does, we still need to dive deeper.
Absolutely.
Now, it strikes me that so often the paradigm we've applied in studying the relationship between physical activity and weight status has focused on weight loss, and the dependent variable has been loss. And while it may not seem dramatic, it seems to me that if you buy into a prevention paradigm, then null is what you're looking for, right? It's no change, right? And yet it seems to me, and I mean I'll defer to you two, but it seems to me that studies that have been designed with that mindset have just been rare. It's let's understand no change in weight, right? The prevention of excessive weight gain just seems to have been a rarely applied paradigm in this scientific field.
Yeah, but just to be fair, I agree, but those are tough studies to do. They involve a long period of time, a big sample size, and it's hard to get people to sign up for a study where they're expecting no outcome. So I agree, but it
may not fit into
tough.
a 5-year funding period.
That's exactly right. There you go. But I do think those are the kinds of studies that, if we had them, would be very, very powerful.
And to some extent, we have them in the natural experiments that are happening all around the United States as communities sort of put into place more physical activity-friendly policies, and they see that at least at the community level, that the prevalence of obesity goes down.
So I'll ask each of you, what did you not get to say that you'd like to say in the 4 minutes we've got here before we take a break?
I'll start out is that one of the things I think a lot about with physical activity is why anybody wants to change. We talk about the environment we live in that's obesity producing, but most of the people we talk to, they like their fast food and they like their big screen TVs and they like their automobiles, and yeah, they would like to be more fit and they would like to be more lean, but they're essentially choosing to not do that. I think we really need to know what's the powerful why. Why is anybody gonna wanna change their physical activity?
Stay tuned. That's tomorrow, right?
I guess I think we should try to understand how we can do the physical activity version of making the healthy choice the natural choice. And I was really taken by a paper that I read as I was pulling this together, a qualitative study in Korean adults that talked about their view of physical activity as being what keeps them in balance as a human being. And I know this is an obesity solutions roundtable, but physical activity has so many health effects. And it's not just the absence of disease, it's, as your tagline says, wellness changes everything. Well, if wellness changes everything, what can we learn from cultures in which that is part of being a balanced individual?
Okay, I think we'll make our transition. Thank you very much to Jim and Aviva.